Okay. Welcome to the March 2024 Medical XR Advisory Council meeting with XRSI. So today we are going to kind of summarize what we've covered last year and what our objectives are for 2024. Next slide. So welcome, Ryan. Welcome, April. Okay. So over 2023, we actually did make progress on many of the priorities that we set, and we still have work in progress over the next year to come. So the main things we're going to update on is who we've heard from at our council meetings, where we're at with the user safety education project, and the risks and recommendations document. Give a summary of the Metaverse Safety Week and highlight more of the media and global engagement work that we've done. Okay, next slide. Yeah, next one. Okay. All right, so last year, Dr. Charles Binkley from Hackensack Meridian Health joined as a council member, and he has deep expertise in bioethics, medical ethics, artificial intelligence, and having that practical knowledge of how things run in healthcare systems. Dr. Jared Kutzen from Mount Sinai Hospital also joined, and his area of expertise is in simulation training and is very well versed and involved in that field where XR is a key modality of simulation training. We heard from Kat Kuzameskas from Shiro Health, which is looking at novel ways to incentivize healthy behavior. Dr. Joe Morgan joined the council from Waya Health, and Joe Morgan is an anesthesiologist in North Carolina and has created the company Waya Health, which is bridging the device access challenge to hospital systems. And Waya was originally developed for distraction during procedures to minimize the use of anesthesia, and is now doing a handful of other applications, is becoming a platform for VR for hospitals. We were also educated by Dr. Ann Lord Bailey from Veterans Health Administration, and who leads the VA Immersive Program, on what is happening in VR and augmented delivery of care in the VA, and learning a little bit more about how we can possibly partner if that's of interest to us. In April, we'll hear from Paul Jones, currently at Immerse, and Paul Jones was previously at AstraZeneca and helped us with gaining a sponsorship for Metaverse Safety Week from AstraZeneca. So we'll learn more about Paul next week or next month. Okay, next slide. Okay. So the bulk of our efforts in 2023 has been on the user safety education. We created a smaller working group of myself, Richard Price of NHS England, Joe Morgan, Kavya Perlman, Oliver Daada, Ryan Cameron, Catherine Subhashini, Vanajit, and Janet Johnson, all contributing in our own way to gather the information that clinicians would need in order to decide if and how to use XR solutions in their practices, primarily in ones that are patient facing. And so this required looking at the global landscape of how XR is used in healthcare practices and what the guidelines and rules are in each of those regions. And then looking at the risks associated with different use cases or categorical use cases. So the difference of using it in neurology versus mental health or physical therapy have different safety and patient considerations. So that analysis has been done. The next kind of process within that is how do we package this in a way that is understandable to and understandable, easy to digest, and useful to a clinician, whether that be a nurse, physical therapist, internist, or so on, that is looking to this. So it needs to be succinct and dynamic and easy to read. So that is the stage we're at now, is actually putting this into a report and a dynamic resource. And we hope to have this completely done by the end of May. So at that point, it should be in that format and open for, before that, open for feedback from the group on its refinement before we actually put it out to the public. Okay. So next slide. So one of the things we did want some input on is what format to, actually, let's go one back. It says different. One of the things we did want input on how this gets distributed is what primary form it should take. So this could be simply a PDF put out on the XRSI website as a resource people can look up as they seek it out. Other possibilities is the information organized as a web page. Another possibility is as a GPT, or what was the right term for it, Banu? An RG?
Yeah, retrieval augmented generation, using all the inputs that we have for this research, and then we can create a customized LLM on all the information, which can answer the specific queries that people would have on the subject.
Right. So in other words, like an augmented search engine in a way, as one possibility, and that would be trained on resources we put into it, not on the open web. Another possibility would be a wiki type page or a Notion type page. So we wanted to hear a bit about the council's opinion on which of those or other possibilities on how this can be disseminated. In what format would it be the most accessible and useful to the population? Ryan or April, any first impressions or examples from other fields that you think are good for us to look at? Yeah.
I don't have enough familiarity with using those kind of tools for this application, so I couldn't really say.
Okay.
If we are aligned and at the pinnacle point where we could, as you mentioned, create that succinct and dynamic publication as the GPT LLM format, that would be great.
Mm-hmm.
I'm not sure if we're there yet, but
Mm-hmm.
that would be great in alignment with where we are in the world with having that access. I'd say somewhere between that and a wiki type format.
Okay. All right. Yeah, there are strengths to each of them, and I'm sure having like that PDF record, the written record, will always be there. But thinking about how is it going to be disseminated first, to actually have it be a tool and a resource. I think that's kind of the second layer that's going to take some work over the next couple months. Okay, all right, we can move on. Okay, so over fall, Ryan and Kavya have been working on synthesizing risks and recommendations resource. This is a very, very thorough report that Ryan can comment a little bit more about, and it's nearly complete. And parts of it are being used in the clinician facing user education. Ryan, did you want to give your quick summary on that, on what objectives you have with completing this?
Sorry, I haven't looked at that for months, so I couldn't, I'd have to look
And
at
so
it
what
again.
I mean, in terms of writing this, what's the key objective that the reader would get out of it?
Well, like it says in the title, I mean, we're trying to just identify risks. I don't think we got to mitigation. I mean, I think we came up with some random suggestions or arbitrary suggestions, but we definitely, I left it thinking we needed to identify as many risks as we could and invite more people to read the risks and weigh in, or see if we could acquire funding for research.
For the recommendations and mitigation side?
Yeah, and also other risks that we may not have identified in this, because this is just a starting, I think. I mean, my point was the whole thing was a starting point to get a conversation going and get people thinking along these lines, and talking about it. So as far as an objective goes, probably starting a conversation about it among professionals and getting them to, providing a seed around which they could have conversations or even create initiatives for research.
Okay.
But I think the risks that we identified were severe enough that we felt it definitely warranted a serious look by everyone. But it was hard to be definitive because we just kind of did ad hoc interviews and no real formal research, and we did just going over the web and kind of looked at existing papers and things. So, and then of course, a lot of it came from my personal experience and being a developer in XR Health. So just stuff that red flags that I noticed.
So would it help to dedicate any of the future council meetings to that discussion and treat it like a roundtable to gather those inputs, at least from who we have within our council? Or are you thinking this needs kind of an outer layer or crossover with the cybersecurity and AI groups?
Yeah, well, it'd be good to find if there's existing groups that are already researching this kind of thing or dedicating resources to researching risks in XR.
Okay.
That, if the council can help us find those or uncover or bring them to the table,
Okay.
that would be one thing we could do. And then additional, if people on the council know of funding sources or research that could use our support, or there could be funds out there. I mean, Kavi and I talked about this a couple of years ago, but there could be funds that are specifically looking for researchers to tap into this project or this topic. And I know that NIST recently announced some kind of funding to look at identifying risks around privacy and XR and security risks and things like that. But I don't know if it was healthcare specific, but obviously it's all kind of related.
Yeah, it's the context.
So, and I think in our paper, I definitely wanted to try and show the crossover between, the risks that would be in healthcare are very much the same as risks that would be anywhere where people are using XR. So, maybe we formally address them in healthcare with a greater imperative because it's actual patient health that's at stake as well as privacy. And that's the focus. But, someone putting XR headset on or using XR is going to face the same kind of risks even if they're gaming or they're
Mhm.
doing an educational experience or something. So I also want to make sure that was highlighted. But Kavya could obviously give probably a more succinct.
So this one needs, it sounds like several months of effort for that second step.
I don't know if it's a task that's a complete do it to completion task. I see it as kind of a living task that would constantly be revisited and updated. I think what we have is complete in and of itself. Like, it serves the purpose of
Mhm.
getting the conversation going and starting, throwing the rock into the pond sort of thing,
Mhm.
or starting to raise the alert and awareness. But I think the task of identifying risks and then mitigating risks is going to be ongoing, because XR
Yeah.
is constantly changing, and
Um,
it's going to have to be a multi-agency responsibility, from government to medical institutions, to researchers and practitioners, and even
So-
patient advocates and patients themselves.
Let me rephrase that then. For the risks portion that you have worked on, when do you think that would be ready to share out? Just for the risks portion.
Oh, I thought it was ready to share now. It's
Mhm.
if the understanding is that this is just the start, we're just trying to get awareness and get people talking about it, then I think we could share it. I mean, I think the last I saw it, it looked like it needed formatting, and
Yeah.
Kavya had been working on that. But other than that, I think the info was good. We
Okay.
were pretty much on the same page that the info was fine. So I was
Okay.
ready for the visual treatment.
So then, the recommendation side of this, or the mitigation strategies, the idea being the risk gets circulated to key people and to get their input on the mitigation side. So kind of the next phase, the next couple of months would be those cycles of input, in order to synthesize that into kind of chapter 2 of this, or 10. I'm not sure how many chapters are in there at this time. But it sounds like that's what's needed.
Yeah, just to put a note on that, though, we wouldn't want to just interview people, because we've kind of done that already. What we need now is either people who have completed formal research in the area to validate the risks,
Mhm.
or beyond what we've accomplished in our little efforts,
All right.
our preliminary efforts.
Got it.
So I don't know that it's anything our council could do by themselves. We would, but we could
Yeah.
certainly reach out and look in the internet and keep an eye out for new research that's coming online, or people that are
Mhm.
publishing,
Okay.
and start to cite that, because we need that formal validation.
For sure. Okay. Welcome, Jared. All right. Next slide. Okay. So Metaverse Safety Week closed out the year for us. And the report from that is available on the Metaverse Safety Week website. And hopefully you've had a chance to look that over since then, and get kind of the summary of what was shared there. But with with the speakers, we had like Walter Greenleaf, Susan Persky, Natalia Kosmina, Joe Morgan. We're really able to kind of cover a lot of breadth, while focusing our conversations on that intersection with AI. Susan Persky focused on how do you gather evidence about the efficacy and safety of XR applications in healthcare. And it's just a really useful framing of that that I lean on. I mean, already did things in much of those ways, but it's nice to have that framework to lean on and share how studies should be designed. And then Natalia kind of highlighted where sensors and peripherals, fit into those wearable devices, fit into the immersive into immersive tech and healthcare applications, and really pointing out that there is just a lack of regulation, a lack of boundaries on how those things can be used. And that's a lot of where her concern is. And then Joe Morgan highlighted how he's using generative AI to create environments within the Waya Health platform, so things can be more personalized for the user, while in a closed system there, while not gathering excessive patient data, but using AI in a way to enhance the experience for the end user. So that's the main thing for Metaverse Safety Week. Just know that the report is available, free to share to others who might be interested in these topics. And I think it's a good entry point on that. Okay, next slide. In terms of kind of the global engagement and media, we've had a few things centered on MedXRSI. Our main effort for spring of last year was putting together the neurotechnology and human rights response to the UN Human Rights Council. And that is one of the half dozen reports that were published. I don't know how many that were submitted, but ours was selected as one of the ones to be published on their site, kind of implying that they're using it as reference. We had an interview session with VR for Health to kind of highlight what MedXRSI is doing generally. And then Kavya and I wrote a perspective piece on the age policy change for the MetaQuest device, occurring simultaneously with Roblox being brought onto their platform, and kind of the risks that come with that for younger children. When we move creeping that younger and younger from 13 to 10, and the amount of time that is typically spent on Roblox that could potentially transfer over to the VR perceptual space. Okay, next. Okay, so that's 2023, and our priorities for 2023 were create that user safety education strategy, and that has a set roadmap that we need to complete in the next 2 months. The fundraising and grant writing, and most of last year was a lot of figuring out the strategy and where those resources are. And we did identify multiple NIST, NSF grants and so on that are suitable. And so the preparation of those has moved into early 2024. The use case research study that kind of got transformed into the report that Ryan was explaining on the risks and recommendations. So part of it went into that, and then part of it went into the user safety education. So after the analysis on the study that had been done at this point, I think 2 to 3 years prior, it was a little bit outdated. Bye, Jared. So the research that was done there is being utilized. It's just being utilized in a different way. And then in terms of the media strategy, we're finding additional outlets and partners to help get the word out in terms of what we're doing at XRSI. We were also at AWE last year and had a booth. Forgot to mention that's kind of part of it, and had good visibility there. We'll have a booth again in 2024, and XRSI members council members were basically, in a sense, recruited to be on in speaking positions at AWE this year. So Liz Rothman is on the stage in her area of expertise. I'll be on a panel for patient safety in XR healthcare in June. So we are making our way forward in having speakers from XRSI more broadly. For the last last years, Kavya's really, held that responsibility and been the voice and face of XRSI across all the divisions. And as we're maturing as an organization, we have more than one of us here well positioned to be able to do that, and in April as well. So I think that's pointing to kind of the strength of the organization as a whole. So that's where we're going in terms of media. Next slide. Okay, so 2024, get things done from 2023. That's number one. In terms of funding, we have submitted an ethical and responsible research application. This is an NSF initiative, and the focus on this is actually on privacy and safety for research. And so this is broader than just within a medical school, but a lot of development of health and medical XR applications start outside of that environment. And the need we identified there is that the researchers and the IRB, the review committees, are not well informed on the technology to understand what the risks are and how to properly manage the devices and the data that come from it. So think about, someone developing a BCI in a engineering school, right? They may be running studies with people and not realize they're doing human subjects research and not even report it to the IRB, which I've seen numerous times. So that's where the focus is there. That's a 3-year project where we would identify the gaps in the review system and the research practices, develop protocols and guidelines, and then test them back out in the field. So that's in progress. Janet Johnson is going to be leading a workshop at the Computer-Human Interaction Conference, which is the main HCI conference. And this is essentially disseminating what XRSI has already developed over the years and that education piece. So again, part of how we are sharing the knowledge and wisdom within XRSI. And so this is, again, kind of focused on researchers. So this is where we've been able to kind of make an inroad, like beyond, or not beyond, let's say a different inroad than the policy pathway, which is just as important, if not more. But this is also a group that can use some education. The third thing coming up this year is the New York Neuromodulation Conference. And what we did here was adapt our report to the UN to a paper for this conference. And this conference is both medical and research, and not expressly extended reality, not expressly spatial computing, but there are a lot of brain-computer interface applications here, different types of neurostimulation, deep brain stimulation, and a whole range of things. So it was really well suited to tailor the research we've done for the UN Human Rights to this audience here. And so that is accepted. That is in August. So for 2024, of course, we're going to have Metaverse Safety Week. So we will get focused on that second half of the year and hopefully give ourselves even more lead time than we did this year to prepare for that. And then as kind of a reminder on the last bullet there, that XRSI has made kind of a shift or an addition to being open to advisory and consultation services for external groups. And so if you know of groups that may benefit or may be in need of the expertise within XRSI, you can feel welcome to bring that to us, and we can follow up. Okay. Any questions on the 2024 plan, or anything to add to it that you think is important? Okay. All right. Okay. And then that But I think that's it for 2024. I'm positive other things will come up. They always do, and half of our 2023 wasn't part of the plan, but we kept it very productive. And I'm looking forward to the new opportunities of 2024. And glad to have the council here. Hope you guys take some time to listen to this and see the recap. Not you guys, but you know, those who couldn't attend today. And we'll see you at the next one. April, any closing thoughts?
I don't
just,
have it.
Oh,
Ryan, go ahead.
go ahead.
No, go ahead, Ryan.
Sorry, I was just going to say I'm certainly available if you want to have
Mhm.
me talk or comment further on things on a panel or something like that.
Okay.
Great.
Given the new direction.
Mhm.
So I just want to make sure that was clear. That's it.
Good. We will lean on you for that for sure. Right. April?
And kind of as Julia and Banu actually mentioned as well, that the agenda is not released yet. So as soon as we do have it, then we'll be that much more prepared to position our people, those that are available. I reached out to a couple that have been available in previous years for AWE as well.
Mhm.
So we're trying to work lock and step with AWE if they would just host what the program will be. But
Yeah.
it's
Well, they have
not new for
posted the
us.
speakers,
Yeah.
but not the agenda. So you
Right.
want like the actual program.
Right.
Yeah. That probably isn't ready yet. Like they're
Nope.
still getting all their expo tables and everything set. But XRSI has the expo table, correct? That's confirmed?
That's confirmed, Banu, right? Yeah.
Okay. And yeah, so I'll be down there, Liz will be down there. I'm not sure how many others will be able to come, but we'll be there to support him. All right. Thank you guys so much, and looking forward to the next council meeting. And we will be following up with the user education group as that smaller working group in the very near term in order to get that back on track. Okay. All right. Thank you guys.
Great.
Thank you so much.
Thank you, everyone.
Bye, everyone.
Bye, everyone.
Cheers.